The 24th Egyptian Thalassemia Association on the occasion of the International Thalassemia Day, 2023. Ladies and gentlemen, on behalf of the Thalassemia International Federation, TIF, the International Family of Thalassemia, which includes patients, doctors, nurses, and other healthcare professionals, we salute our friends and colleagues in Egypt on this occasion honoring the International Thalassemia Day, 8th of May. The 8th of May celebrations bring thalassemia to the attention of the entire global community, the health authorities and the professionals who devote their professional lives to a patient. Especially I wish to thank the organizers, the Egyptian Thalassemia Association, for promoting the cause and giving thalassemia a prominent place in the Egyptian health agenda. As you all know, in Egypt, thalassemia is the commonest hereditary condition. We are aware of around 10,000 thalassemia patients and around 1,000 sickle cell disease patients. It is possible that this number is underestimated in the absence of a national, a cross-country patient registry and/or updated epidemiological and micromapping studies, particularly since, based on existing published data and other parameters, over 2,500 new affected births are expected each year. With this burden of disease, ladies and gentlemen, distinguished audience, it is important to formulate a national policy to include all aspects of patient care and also measures to limit the births of new cases. Above all, however, is the welfare of existing cases. Thalassemia care in many countries has achieved today survival of thalassemia patients well into adult life, mainly by adopting good blood transfusion and appropriate chelation practices, but also by adopting follow-up protocols, which aim to detect early and prevent, if possible, complications to vital organs. Optimum treatment, including access to well-organized and disease-specific multidisciplinary care, will indeed improve significantly the quality of life of the patients and achieve social integration. Egypt is a country at the heart of the Thalassemia International Federation, with long-standing membership in its advisory and patients' parents groups, including names such as Professor Amal al-Bashlawi and Manal Zatar, amongst many eminent others. It is a country that focused throughout the years, their governments and their ministries of health, considerable attention to this disorder, with many and multiple efforts for providing universal health coverage to all patients. However, the many challenges, difficulties, and other national priorities have prevented the implementation of a holistic prevention and management program across all ages throughout the country. And this despite the huge academic competency that exists in this country and which the Thalassemia International Federation highly commends. More centers of expertise need to develop to cover the needs of patients across the country based on international criteria developed and promoted by the Thalassemia International Federation. These are essential for such a challenging disorder to achieve the best possible results for long survival and improved quality of life. Long-term efforts have already produced results in Egypt, reflected today in a community of adult patients who have knowledge and a voice to express their needs, both social and medical. Albeit, ladies and gentlemen, more is needed for such progress to be achieved for all patients across the country. Patients can be partners to the medical community in advocating for quality improvements, which should be a continual process in all countries, a practice adopted in current years mainly in Europe and some of the Western world countries. The partnership of the Egyptian Thalassemia Association and the Thalassemia International Federation throughout the years is meant to help this young generation of patients to make their presence and their needs known, to take up a stronger advocacy role for service development in partnership always with the whole relevant healthcare professional community. Knowing the huge burden of this condition and its complications, the reduction in birth incidence, ladies and gentlemen, is indeed a goal which we are very glad to note is now being implemented in Egypt. Without reducing affected births, the burden to the health service, to families and to patients themselves becomes unbearable. It results in a reduction in the range and quality of services for the care to individual patients, as resources are overwhelmed, since the costs are ultimately increased, consequent to rapidly increasing complications in vital organs and the need to address them. Raising community awareness, screening for carriers before marriage, appropriate counseling with the aim always of informed choice, other strategies, for example, that have been proven by practical application in many countries to be effective, including but not confined to Cyprus, Greece, Italy, the UK, France, and the United Arab Emirates. It is now more than ever important to control thalassemia. We are entering the era of new advanced innovative therapies, an ultimate cure that require well-organized disease-specific services, effective prevention program, and appropriate assessment of their value versus their cost, which by definition is high. The challenges are many and multiple, but those medicines really need to reach the patient. They need to become available and accessible to the patient, honoring their basic human rights. Our patients should now be in good health so as to benefit from these new treatments. New therapies, ladies and gentlemen, are almost ready for entering in our treatment protocols. These include non-curative approaches like luspatercept, which focuses on reducing transfusion requirements, and curative, gene-based approaches mainly, as well as many others in different stages today of investigation and clinical phases. But affordability and accessibility are now the goals that the Thalassemia International Federation is advocating for. So let us all join hands to bring new technologies near to our patients. Ending, I salute this Congress and wish to you all enjoyable and fruitful deliberations. Thank you for giving us this opportunity.